So it's a really interesting time in healthcare. So many challenges, so much change that's happening. My name's Cyrus Bethasia. I'm the Chief Growth Officer in UnitedHealth Group, which is part of UnitedHealth Group, and I'd love to learn more about you.
I'm Eric Dobik. I'm an Optum nurse practitioner. I predominantly work with elderly patients that just left the hospital. One of the issues I'm tackling is hospital readmission rate. Currently, 18% of elderly adults are readmitted to the hospital within 30 days. And these are from typically easily preventable conditions. One of the initiatives that I'm rolling out is the TTS program, which stands for Transition to Skilled Nursing. The patients come from the hospital and they are with me for a short-term rehab program. We found that those involved in the TTS program decreased their length of stay by 7 days, which equates to a cost savings of $2,500, not to mention a quicker recovery.
My name is Joy Quaidu, and I work in Optum, and my focus is on the pharmacy benefit management side of the business. One of the areas that my team is focused on is on medication waste. 50% of our cancer patients were discontinuing their therapy within the 30 days. And this results in a lot of cancer medication going unused. So we developed a program called SmartFill that allows us to half the medication each month and double our contact with our members. And as a result, 96% of our patients have been able to remain on therapy.
I think it's great to hear about the commonalities in our work with the hospital readmission, avoidance type programs. Connects back to my work. I work a lot with affordable housing. People experiencing housing instability are 10 times more likely to be admitted to the hospital or readmitted than your average Medicaid member. So my team sources dignified housing to help these members to transition safely from the hospital into housing. We have seen results of 55% reduction in hospital admissions and 43% reduction in ER use for the populations that we've served. This is something I'm really passionate about, and as I look around United Healthcare, I think a lot of us are passionate about a lot of different things.
Working for UnitedHealth Group has offered a lot of opportunity because of the size and the vastness of the services that we do offer. For me, it's personally being able to support my father as a caretaker. Having been inside of the industry, it allows me the opportunity to be able to help him become more educated about his health care.
I have a strong personal connection. My grandpa was hospitalized 2 years ago with a heart attack. His rehab facility did not have a program like TTS, so his short-term rehab stay turned into a 7-month ordeal going into and out of the hospital. Everything I do is to help individuals like my grandfather.
Coming to the United States as a first-generation immigrant, I didn't have health insurance for most of my life. So I started in nursing, and then from nursing was able to really understand healthcare and health insurance. From there, I was able to really work my way up and directly impact people who might have been excluded from healthcare, similar to myself.
One of the reasons why I found this opportunity so exciting was as a woman of color coming to UnitedHealth Group, I felt as though I was not a traditional employee. I felt that there was an opportunity for a voice, for my voice, to be reflected in the work that they were doing. And here I have the opportunity to not only thrive, but to shake things up a little bit.
So Optum has given me the unique opportunity to really spend as much time with my patients as they need. And that's something that I can't get working in a hospital, and I can't get working for another organization, and it's something I'm very passionate about.